Dr. Beth, I have some questions for you about conjunctivitis.
Hi there.
Hello. So let's say a patient calls and says, my child woke up with discharge in the eye. Should I make an appointment? What is your advice?
We would recommend not to call right away, to observe the child for at least 4 to 6 hours and see if the discharge continues. So just clean the eye with a warm washcloth and then kind of assess the child over at least 4 hours.
Okay.
And if the discharge is continuous, like a thick yellow or green discharge, then you can call during office hours and talk to a nurse.
Okay. Is this something that you would consider an emergency to be calling after hours or have to rush to the ER? Is it something that typically can be handled in the office?
Good question. It's not considered an emergency, so we would appreciate you calling during office hours if you want to discuss.
Okay, perfect. And what exactly is pink eye?
So pink eye is kind of just like a generic term for conjunctivitis, and the pink eye the schools are referring to is like the bacterial one, but pink eye in general is just like a red eye.
Okay.
So that can be either due to viruses, bacteria, or allergic.
Okay.
So it's important to differentiate which one it is.
And what are the different treatment options for this?
So if it's viral, you're going to just have a kid that has a red eye and it'll be watery and it might be painful. There's no treatment. It's just like having a cold.
Mm-hmm.
So you just want to like clean it if it gets a little bit discharge in the morning. If it's bacterial, then they do need to be on antibiotic drops. And if it's allergic, also there are drops available over the counter.
Now, can my child go to school if they've got pink eye?
They can go to school if it's viral or allergic,
Okay.
and then they can go to school with bacterial after they've been on the drops for 24 hours.
24 hours.
Yeah.
Typically, how long does it take for a child to feel better or for the redness to dissipate?
I would say a day or two.
A day or two?
Yeah.
Okay. Do you have any other advice for parents if they wake up and the child's got an eye that's pretty gunky and red? Or
We would just say like not to call urgently because we really can't tell at that point if it's allergic, bacterial, or viral. You kind of have to assess it over at least 4 to 6 hours. So just kind of see how it goes. And whenever it's a newborn though, a baby under 4 weeks with a red eye or any swelling or discharge, we would want to see the baby.
perfect. Awesome.
Or
Thank
talk to
you.
a nurse. Yeah.
Well, thanks for answering our questions.
Okay, you're welcome.